In a special way, in PHC Candolim, we are organizing Living Happily with Diabetes, a program meant for diabetic patients who are unable to control their blood sugars. Due to their high blood sugars, we have been running helter-skelter for treatment.
Our diabetes programs have even started much before during the vaccination drive. We'll be doing blood sugar testing and high blood pressure testing as well simultaneously to all the beneficiaries who are coming for the vaccination drive. And we realized that a lot of our youngsters have these problems of high diabetes and high blood pressure. I mean, we the Lions Club along with the community got involved in door-to-door campaigning with the help of the Primary Health Center Candolim, testing for diabetes and trying to get them reversed from their diabetes problems.
Now diabetes are very going high because of lifestyle of the people and eating habit.
This diabetes, which is a very major problem now in our village, where the youngsters as well as the elderly.
In terms of diabetes care, what we've been looking at in the area is that we found so many people, youngsters, who have very, very high blood sugar levels at borderline situations in terms of being diabetics.
The Living Happily with Diabetes program is held at the PHC Candolim on every Tuesdays and Fridays at 10 o'clock. The main aim of this program is to reverse diabetes.
Here at the Primary Health Center Candolim, we invite all the patients who come for their blood sugar checking. We have it twice a week on Tuesdays and Fridays. So this program is held immediately after blood sugar is checked in the morning itself, as they wait for their turn in consultation for the doctor. So they come here in this place, which is adjacent to the Primary Health Center.
So we have started our Living Happily with Diabetic camp over here, and we are gathering all our diabetic patients and taking sessions for them, and we are focusing on healthy living style, healthy food habits and exercise for the diabetic, so that they can overcome with diabetes without medicines, and much they have to indulge in exercise.
I am a diabetic patient, and I used to come for the primary health center for my treatment. Lions Club, there is a program going on, the session of the exercise and all for diabetic people. So I joined this, and I feeling very happy to doing all that what is in the session going on, all exercises, even yoga also. With that I am happy. It was going 130 by 7 pressure, and diabetes sometimes it goes 168 to 70, sometimes 200, and now it is low, about 150.
I have come to know about this program through my friends, and then I joined this Living Happily Diabetes, and since I have joined here I am much better and I feel happy. Also my wife has joined along with me, and we both come for the session daily, and now we have control over our diabetes. It was earlier about 150, 160. The last time I checked it was 120.
When I came here, I was like, my diabetes was high. It was more than 450 and all. So now the diabetes, after joining here, the diabetes come like 200, 230 and all. But it will come down by doing and all. But I am very happy that you can't beat diabetes when you are alone. When you come in a community, you can beat your diabetes and be happy like before. I am very happy to join this program, and I really love the staff and everybody who is involved in this.
Together we can beat diabetes.
We at the club are very happy to be working with the Primary Health Center and the village Panchayat of Candolim to improve the health care facilities of the community. We have started the program of Living Happily with Diabetes, wherein the beneficiaries get the advantage of having exercise routines, yoga and games, and having fun at the PHC in order to improve their blood sugar levels and their blood pressure. We have been trained by the primary health center to do the sugar testing and the blood pressure of patients. We shall be carrying this forward in our homes so that we reach the community at large.
I am committed to the health of all the villagers of Candolim, and all of us have to get together with different organizations. You could say the Lions Club, the village Candolim, and the PHC of Candolim, the health center of Candolim. We have to work, and we have done this earlier. We worked on the COVID vaccination, which was one of the best in India, well organized with the village Panchayat, the Lions Club and the health. You did such a wonderful job.
What we've learned from the COVID situation, especially during the time when we were conducting vaccinations for all of the people of the area, is that the community needs to be with the healthcare specialists, with the Department of Health Services, so that we look at healthcare for all in our country. That is the final objective that we are looking at, wherein India becomes health care sufficient on its own. It is very, very important for communities to come together with the healthcare facilities, with the local governmental organizations, and see to it that they form a bonding, and that is the only way that we can be sure that we will have healthcare for all.